Why is it that some people are against it and they're showing all these commercials about don't vote for Obamacare? You know those commercials again.
All right.
So what's the?
So that's a good question. So you want to know why is anybody against it? What do you guys think?
I think it's the more wealthier people that's really against it because they have to pay more money.
They don't want to.
But that make me seem
Well,
like
the video said that there will be certain people that will have to pay more as a result of this,
Coming up
which
more in their pocket.
the wealthy people will be one of those groups.
'Cause I was
And
trying
so
to-
obviously they want to keep that money in their pocket, so they're not going to be
But
forced.
they're making the
It's like
commercial
massive
seem
votes.
like you're like, well, I won't be able to do this or I'll lose this type of care if we do the Obamacare or this type of plan that I have.
That's what money does, though. They can create all types of ads
And the
and
larger
commercials.
companies, they have to cover their workers.
Right.
It's guaranteed.
And then also companies, as far as like we mentioned, hospitals and insurance companies are gonna receive less or possibly have to pay more. So there's a lot of different groups that have their reasons for not wanting to do this. Yes, ma'am.
Okay, what about people, it said full-time employees, but a lot of people are hiring people as part-time.
Yep.
Well, that's one way that companies are trying to get around it is by eliminating full-time positions and creating part-time positions.
So that's why I'm
To
saying,
avoid some of those penalties and fines.
how is that gonna help with the jobs? There may be less jobs.
Not necessarily. It kind of just depends on, if you're working full-time somewhere and you get put, taken down to part-time, you're not losing your job, you're just losing hours. Now, if you choose to leave and try to find a job somewhere else, then possibly you're out of work. Or what if an employer is hiring more people just at part-time level?
Yeah.
So it kind of just depends. It may create more jobs, but just at a lower level.
So how does that affect people like me that I'm like on government insurance, like TRICARE and all that, or military stuff?
Well, I don't know the details about your plan, but there may be some things that you're not covered with. So now you'll have the opportunity for those areas that you don't have coverage to possibly go into the marketplace.
'Cause I mainly have like full coverage, like the same benefits I had when I was in the Army.
Well, some people, like the video said, it won't really affect them or make any changes. But for people, mostly for people who don't have any coverage at all or are underinsured or don't have enough coverage, that's where the biggest of changes are going to take place.
I know this morning they had on the radio, there's a guy from, I think he was a senior executive from some healthcare company.
Mm-hmm.
He was explaining that if you are a vet and you feel like you're not getting enough benefits from the VA,
Right.
you could apply for for that to see which one weighs better.
Right. You may find a plan in the marketplace that's better than what you have right now.
And if you're working part-time and you feel like you won't get insurance, you can also apply also.
Right.
Single, to see if you'll be qualified. And he said, chances are you will be qualified
Right.
for insurance.
Yeah, that's like the only issue that I would have like me being a veteran. If I have an emergency, like get sick, the VA doesn't take emergencies like normal hospital do. Go to the emergency room, you have to be like basically dying. But then if you go to another hospital, they may not pay it because you have to get approved and
Right.
everything like that. So what's the
You
point of
can apply
having?
for it.
Yeah, what's the point of having like
Right.
emergency situation if they don't take emergency situation unless you're basically dying?
So in a situation like that, you may want to evaluate what they're offering in the marketplace, compare it to what you already have to see which one's better. Any other comments about?
I happen to be one of those people that are under my parents' insurance.
Right.
And I'm under my parents' insurance until May. Now, my job, they had us sign for the insurance and everything. And so what will happen, like, for me, once
Are you part-time or full-time?
I'm full-time? I
Well,
don't plan on being
depending on
full-time
what
next
the size of your company, like if there's 50 or more people in your company, like the video said, then those companies are going to be required to provide you with coverage or pay a fine. So I guess you would just kind of transition from your parents' plan to a plan with your company, unless they're not offering it, in which case then you would go to the marketplace and then they would just get fined. Now, what would that plan look like? In my own personal experiences, I know when I was covered under my parents' insurance, it was a really good plan. And then as opposed when I had to go out and have my own plan under my job, it wasn't as good. So you may find that even if you get coverage from your job, the coverage or the plan may not be as favorable as the one that you have right now. So, but some coverage is better than no coverage, because there's been a lot of students before this that couldn't be on their parents' plan anymore and were still in school, maybe didn't have a job and just didn't have any insurance. So now that group of people will now have an option for coverage, which is good. Anybody else? In case it hasn't hit home yet, this is a very big movement. This may be the biggest healthcare movement that you see in your lifetime. So it's something that you should really research and become well versed in, because this is like a huge movement within healthcare. It's something that's never been done before. In essence, this is making history in the United States, what's going on right now. So you may not be able to tell exactly what's going on right now, but it's something very big. This is the first time that we've ever been able to offer coverage like this to everybody in the United States. So I wanted to take some time to talk about it. The website is www.healthcare.gov. Very basic, healthcare.gov. So if you don't have coverage, or you're underinsured, or you know people that don't have insurance, you can send them there. And I'll just quickly pull up the website so you can see what it looks like. It's open today, starting today. So basically, this is the website. It's pretty user-friendly from what I see. It kind of prompts you, tells you where to go. If you're an individual or family, you go here. If you're a small business. So this is the website that you would go to get started if you want the coverage, or if you know somebody that needs coverage. And then they also have a link here for you to get more information. So again, that website is www.healthcare.gov. Does anybody else have any other comments about Affordable Care Act? All right, we're gonna get into our lecture today, which is about information technology. And we may not have time to finish it, but we'll at least get started. So I'm pretty sure everybody knows what information technology is. Hopefully at this point, everybody knows, right? Basically what's happening in healthcare is information technology is something that's historically been in the back office, or people behind the scenes kind of work with it. But now there's been a movement to where information technology is also moving more to the clinical side. This is evident in the push for electronic medical records, as well as a lot of other technological functions that have been going on recently. One of the reasons that they've kind of pushed the information technology is because they found that it can create more efficiency, so it can help people do their job better, do their job faster, which will ultimately also save money and increase safety and quality care for patients. So that's been some of the biggest reasons for the push for information technology. So obviously, as healthcare becomes more involved with information technology, it'll ultimately affect our roles as managers, or as healthcare managers, hopefully in a good way. Traditionally or historically, one of the main reasons that information technology was used in the back office or the back side of healthcare was to kind of help with the revenues, the expenses, and keeping the budgets in line. Some of the systems that have been implemented are here. So they include billing and receivables, cost accounting, fundraising, budget systems, enterprise resource planning, or just regular standard office applications. So those are all things that are used via information technology, specifically for managers. So what types of healthcare settings have been using information technology? Well, obviously hospitals, nursing homes, pharmacists or pharmacies. Home health care is now using information technology. Obviously, insurance companies are using it. And a lot of times it's used for administrative support or using the data to analyze or plan or forecast budgets and numbers and things like that. Now that it's moving to the clinical settings, the hope is that the increase of information technology will reduce medical errors. So hopefully, I don't know if any of you guys have seen within a hospital, they're called Pyxis machines, where it's kind of like a cash register for drugs. Basically, the provider goes up to the screen and they type in a code or whatever, or they type in the patient's information, and the drug just kind of pops out. And so that's a good example of, you know, how in the pharmacy area they've used information technology to try to reduce medical error, because that way the medicine is just being issued out, and you don't have to worry about somebody miscounting the pills or giving somebody the wrong pill because it's more automated. So that's one example of how the use of information technology is hopefully going to reduce medical errors. We just talked about that, filling prescriptions. It's also being used in laboratory tests. Can anybody remember, you know, years back when you would have tests done, you'd have to wait weeks and weeks to get your results?
Yeah.
And now you can get your results on your phone or in your email, or they'll call you, automated call with the results. So that's another example of how information technology is making us more efficient, saving us time, saving us money with that automated call. That is saving the cost of someone, a physical person, having to call you. So those are just kind of examples. Also radiology images, again, the same thing, where you can have your x-ray done and see the results the same day while you're in the office. The radiologists are able to view the images on a screen as opposed to putting it up to the light with the old school film. So information technology is kind of infiltrating all different areas within healthcare, making all of us more efficient, allowing us to save time. So one of the reasons why people have been opposed to information technology is because they thought that the systems were too complex, they were too confusing, take too much time. This is something we're still kind of having an issue with. Some providers who don't want to use the electronic medical records because they say it takes too much time to type it in, or they can't understand the systems. And we'll talk a little bit more about that later. Some more changes. Medical devices. Imaging systems have become a lot more sophisticated. Now they have robotic surgery that has become pretty popular in some of the larger hospitals, the teaching hospitals. They use robotic surgery. Again, within the clinical areas, the systems have also become more sophisticated, and they're starting now to create networks so that you can connect your EMR with other systems, and I think that's kind of the direction that we're moving in. So I think it's only going to become even more sophisticated as time goes by. How does this affect healthcare managers? Well, as a healthcare manager, you may not, work on the clinical floor. You may not be working in the EMR system every day, but you still will need to know the basics of the system and how it works and how to read the information that's in the system, even if you're not charting it every day or using it every day. There was a study in 1991 by the Institute of Medicine that was released that basically said that electronic medical records was something that was going to be essential, something that was going to be necessary to the healthcare industry. And then later on in 2000, there was another report by the Institute of Medicine that came out that also spoke to the fact that automation would improve patient safety, so make things more safe for our patients. So as a result of these two reports, as well as other people kind of pushing for automation and information technology, that's kind of been the reason why there's been a push for EMR, and more hospitals and health organizations have adopted EMR. So we've all heard about EMR, electronic medical records, but you may not know exactly everything that it does. So we'll talk a little bit about some of the different things that it can do. So it's a clinical data repository. Basically what that means is it's a system that holds a whole lot of data, a whole lot of clinical data, all of your history, medical history. It's also a clinical decision support. Does anybody know what that means? Decision support deals with kind of analyzing the data. So decision support, if you are a patient that has come in multiple times with the same symptoms, the decision support analytics might, you might be able to use that data to figure out why you're continuing to come in, or have you been diagnosed properly? So it allows you to do different types of reports and studies and analysis within that area in the system. Control medical vocabulary. Why might that be important within the EMR? Control medical vocabulary. People might define things differently, right? If you have more than one person in the chart, and you have one person that calls this an elbow and you have another person that calls this a pointing thing, you need some type of control vocabulary, right? So that everything is consistent, everything is the same. So the controlled medical vocabulary kind of, and that is going to cut down on medical errors, because if everybody's calling it an elbow, there's going to be more consistency as opposed to people calling things different things. Physician order entry. Does anybody know what that is?
Orders for like certain things like X-rays.
You're close. It deals mostly with drugs, but that's basically what it is. It's a component that allows for ordering of prescriptions to happen. Again, the intent is to cut down on prescription errors. And then clinical documentation. So it allows you to obviously make documentation for the patients within the system. So those are the main areas, all within the EMR. EMR obviously is now being used in inpatient settings as well as outpatient settings. And it's used by not just the doctors, but all the different types of providers. So the RNs, the LPNs, the nurse practitioners, physician assistants can all use the EMR to document and kind of manage the patient while they're in your care. It also serves as a legal record of care for a patient. Why might that be something good or something advantageous?
Well, prove,
Proof?
like, for prove that they've done something unethical or
Okay.
unnecessary for like lawsuit reasons.
Yep,
And
lawsuit.
like proof of medical consent or.
Proof of medical consent. Did you have your hand up? So those are both absolutely right. Obviously, in situations for a lawsuit, you have documentation. Or what if you're starting a new job and you have record that you had a TV shot or something. So it doesn't always have to be something bad or the lawsuit or something, but just legal documentation can be held within the EMR. So that's one reason why it's a benefit.
It cuts down on the loss of medical records and stuff too.
Yeah, definitely. I mean, if you think back to Hurricane Katrina, a lot of medical records were lost. And as a result, you had these people that had been displaced from their homes, had nowhere to go. They were just walking into a random doctor's office with complaints of pain, and they had no way to trace their medical history because the paper files were, ruined or lost.
In a situation like that, even if the computer crashes, you will lose it too, right, the information?
Well, that's a good question. Most of these EMRs, or at least the sophisticated ones, are the ones that hopefully most of the healthcare organizations are purchasing, are connected to a server somewhere off in La La Land. And so most of these systems are backed up daily, if not more than multiple times a day, so that if an outage happens or something happens, that they have it backed up somewhere. Does somebody else have a question? So MRAM, it stands for Electronic Medical Record Analytical Model. And basically it's a model that was developed to document and capture the growth or progress of organizations adopting EMR. So it's basically like a scale, and it goes from 0 to 8. And as you go higher, that means that you have further adopted EMR. So it'll make sense when I go to this chart. So this is an an MRAM model. And you have stages from 0 to 8 or 0 to 7. And at stage 0, basically you've done nothing. So you haven't adopted EMR, you haven't done anything, nothing's been installed or anything. And then stage 1, you have the ancillaries, so the lab, radiology, pharmacy, they've adopted some type of EMR. That's stage 1. Stage 2, you have the controlled medical vocabulary, you may have document imaging, so you have some pieces of the EMR at stage 2. By stage 3, you have nursing and clinical documentation, you have PACS, which is a document imaging system, so, and then by stage 4, you have CPOE, you have clinical decision support. By stage 5, you have closed loop medication administration. Stage 6, you have physician documentation, full CDSS, which is variance and compliance. So you're pretty high up once you get to stage 6. And then stage 7, you've adopted pretty much all the components of EMR, you're fully functioning, you have data warehousing, and you have data continuity with the ED, so that means you're hooked up with the ED, with your system. And also with outpatient and ambulatory. So stage 7 is at the top. So if you're here, you're doing great, you've adopted everything, it's fully functioning, you have all these different components. So this is optimal, this is where you want to be as an organization at stage 7. And I kind of just went through this, but basically stages 0 to 1 is very basic automation. Stage 2, you're starting to bring in data. And in stages 3 through 6, you have implementation of more advanced clinical systems. And in stage 7, you're at the point where you can share your data with outside entities. Bless you. So this is one chart or table. It shows you from 2008 and 2009 what the different levels were. So basically, for this study, in 2008, there were 5,048 hospitals that did this. And then in 2009, there were 5,167 hospitals. So out of all these hospitals, we'll round it up and say 18% in 2008 was at stage 0. And then it went down in 2009, which is good. There was only 13%. So if you go through all these numbers from 2008 to 2009, you can see that the numbers change, which is a good thing because that means that more hospitals were moving up in the steps and starting to adopt EMR. And you might say, well, it's kind of old. So what I did was, I did a little research, and I have an updated table for you guys. Can you guys see that?
Mm-hmm.
So this is more current. This is from 2012 and this was from 2013 actually, quarters 1 and 2. And the numbers were 5,441 hospitals for the first quarter and then 5,439 hospitals for the second quarter. So now at stage 0, we have 7.8 and 7.2. Does anybody remember what the percentages were for the old table? They were higher, right? So that's good, right? It's good because these numbers are lower now, which means that more hospitals have been implementing these steps and they're moving up. So if we go to stage 1, we're at about 4%, and then stage 2, we're about 10. Stage 3, nursing clinical documentation, we have 36% in the first quarter and 35% in the second quarter. So I'm going to pause here and go back to the other slide, and we're going to compare stage 3. So not too much different, right? But a little bit of change. So I'm going to go back to the table. Keep going. Stage 4, we're about 14%, 15%. Stage 5, we're closer to around 18%. Stage 6, we're up to 10%. And stage 7, we're about 2%. So let's go back and look at our stage 7. And that's good, right? nobody was up here pretty much at stage 7 back in '09. So now, I showed you those two tables so that you can see that as a whole, healthcare organizations are adopting EMR more, they're moving up. So not only are more hospitals adopting EMR, they're becoming more sophisticated as well as the time goes by. Now you may say, well, this seems like a no-brainer. Every hospital should have EMR. Why isn't everybody on board? And here are some of the reasons why. Number one, cost. The cost to implement these types of systems are very, very expensive because for a few reasons. Number one, a lot of times hospitals have to purchase new products, new computers to be able to withstand the EMR system. Maybe their computers are too old and can't handle all the memory that it takes for the EMR. Not only that, you have to actually purchase the system itself. And the EMR systems are fairly expensive. There's some that are less costly than others, but the ones that are really good are the ones, you pretty much get what you pay for. So the really good ones are gonna be kind of expensive. Not only that, after you purchase the system, you gotta have somebody install it, right? So most of these companies have representatives or vendors that physically go out to the hospitals to help the hospitals with the installation and the troubleshooting. So that's another cost. And then if you choose to have someone that you can continue to contact for technical support, that may be another monthly fee that you have to add on. Some people choose not to have that. But most people that initially adopt the EMR want to have that regular customer support that they can contact. And then if you don't already have someone in your organization that's knowledgeable and able to run this, you gotta hire somebody, right? That's there every day, day to day to run the system. So there's a lot of cost, slow development of data standards. So some people are just slow to embrace change, and they don't want to get up to the requirements that are going on right now. They kind of want to just keep doing what they're doing right now and don't want to make those changes. Some people report that the systems are not easy to use, they're not user-friendly, it's going to take them more time, it's confusing, it's too complex. And then patients. There's pushback from patients sometimes. Some patients don't want the EMR. They don't want their information to be out in a server or online somewhere because they're afraid someone may hack it or they may steal their information. So there's also pushback from our customers, our patients. So we can pretty much assume that most of our care is done in the doctor's office, right? When we get sick, most of the time, unless it's a dire emergency, we're gonna go to our doctor first, right? But the ironic thing about that is that physician offices have been the least of all groups to adopt EMR. And why do you think that might be the case? Sorry?
Less patients, they're smaller, they don't have much money to.
Right. It's a smaller organization, so it's not a big hospital that can fund this. They're just a small practice. So maybe they don't have the money to fund this. So yeah, you're right. Can you think of any other reasons? I'm sorry?
The cost of maintenance.
Yeah, cost of maintenance. Even if they can afford the system, maybe they don't have the staff or somebody to run it, right? Or to call if something goes wrong. So pretty much all of the reasons that we've kind of discussed already are the main reasons that the physicians have pushed back so much within their offices to adopt the EMR. As far as hospitals go, about 90% of hospitals at this point have some type of EMR, as opposed to physician practices where it's only about 37 or 40%, so almost half. So here you can see in the numbers how big of a difference it is with physician practices adopting EMR as opposed to hospitals. Of course, there's some physician practices that are fairly big, large in size, so those are usually quicker to adopt the EMR. than the smaller ones. But hopefully, as a whole, they'll all start to adopt EMR. Here are some more challenges to adopting EMR. We talked about patient privacy, lack of standard vocabulary, cost, user-friendly. And some people just think that the EMRs are gonna slow them down or make them less of a good provider. I've heard providers say things like, when I go into the room, I don't wanna have to stand behind the computer, or I just wanna be able to go to the bedside of the patient and not be bothered by any computer or information system. So some people fear that it'll make them less personable of a provider, which may not necessarily always be the case, but that has been one of the reasons that people have been slow to adopt. Federal responses. So there's been a few federal responses for the push for EMR. Can anybody think of one recent one? And you may not know the answer to this, in addition to the ones up here. Has anybody heard of meaningful use? Meaningful use has been a response by the federal government to encourage physicians to adopt EMR and adopt information technology systems, and basically they have until 2015 to adopt some type of electronic or information technology system in their organization, or they'll face a fine or penalty. So this has been the government's push to kind of motivate or incentivize organizations to adopt some type of EMR as well by 2015. So what's the future of HIT? Well, we're already starting to see it. We talked about you being able to access things from your phone, your tablet, virtual healthcare. I have a friend that's a psychiatrist, and she does some of her sessions with her clients via Skype, and more doctors are starting to take this.
You said they're gonna push for that for 2015.
Mm-hmm.
How is it gonna work with them older doctors that's used to going
Yeah.
to having?
Oh, yeah.
That's a lot.
Yeah, that's a great question, and that's kind of one of the things that healthcare managers are facing right now. If you're a manager within an office and you have an older physician and you're trying to push them like, look, you need to adopt this before 2015 or you're gonna face a fine, it is a big challenge. I think that between that and some of the other changes in healthcare, some of those older doctors are probably starting to opt to just close their practice,
Or just respond.
close their practice or go work within the hospital. Because you are going to have some older physicians, and not just all older physicians. There's some younger physicians that don't want to do this either. So it is a challenge that we will face as healthcare managers to try to get our physicians on board with this. There's going to be some people that don't do it though, and they'll just have to face a fine. Some may be willing to just pay the fine. But it's a great question. There are going to be some of the older doctors that aren't too tech savvy that don't want to deal with this. So if I were an older doctor, I'd probably hire another doctor that was younger, just let them handle it for me. But you have some older doctors that there's only them within the practice. It's just a one physician practice. So in those cases, they'll either have to jump on ship or face the fine. Good question. Any other questions? Here's some other future of HIT. Some patients will start to wear monitors and vests to kind of regulate their heart activity and other types of activity. Microchips. There's changes in genetics. We've already kind of seen that as well. So we're gonna kind of summarize all this up. How does this affect you as a manager? As I said earlier, it may not affect you directly, but as Mr. McCray just pointed out, you may have opposition from some of the other people that you're managing as opposed to the evolution of EMR. So as a manager, we have to understand why it's beneficial for the organization and why we need to get them on board, even if we're not necessarily using it every day. We still kind of need to be able to communicate the reasons why they should adopt it in the event that we face pushback from people. Any other questions about what we talked about today? All right, so I'm going to